One of the most alarming trends in the drug overdose crisis is the rising involvement of synthetic opiates, psychostimulants, and cocaine. These substances are often mixed with other drugs, increasing the risk of fatal overdoses. According to the CDC, the number of drug overdose deaths involving synthetic opioids, excluding methadone, psychostimulants with abuse potential, and cocaine continued to increase compared to the previous year. Synthetic opioids, such as fentanyl and its analogs, are extremely potent and can be deadly even in small doses. They are often added to heroin, counterfeit pills, or other drugs without the user's knowledge. The CDC estimates that synthetic opioids were involved in 77,000 overdose deaths in the 12-month period ending in April 2022, a 38% increase from the previous year. Synthetic opioids accounted for more than 70% of all opioid-related overdose deaths. Psychostimulants, such as methamphetamine and cocaine, are stimulant drugs that can cause euphoria, increased energy, and alertness. They can also have harmful effects on the heart, blood pressure, and brain. The CDC estimates that psychostimulants were involved in 28,000 overdose deaths in the 12-month period ending in April 2022, a 17% increase from the previous year. Psychostimulants accounted for more than 25% of all drug overdose deaths. Cocaine is another stimulant drug that can be snorted, smoked, or injected. It can also be mixed with fentanyl or other synthetic opiates, increasing the risk of overdose. The CDC estimates that cocaine was involved in 23,000 overdose deaths in the 12-month period ending in April 2022, a 9% increase from the previous year. Cocaine accounted for more than 21% of all drug overdose deaths. These statistics show that the drug overdose crisis is not only driven by opiates, but also by other substances that are often used in combination. The increasing availability and potency of these drugs pose a serious threat to public health and safety. To prevent and reduce drug overdose deaths, a comprehensive approach is needed that includes prevention, treatment, harm reduction, and recovery support services. One of the most alarming trends in the United States in 2022 was the rise of drug overdose deaths. According to the CDC, more than 108,000 people died from drug overdoses in the 12 months ending in April 2022, a 6.9% increase from the previous year. This was the highest number of drug overdose deaths ever recorded in a 12-month period. The main driver of this surge was the opioid crisis, which claimed the lives of nearly 77,000 people in the same period. Opioids are a class of drugs that include prescription painkillers, heroin, and synthetic substances like fentanyl. Fentanyl is a powerful opioid that is 50 to 100 times more potent than morphine and can be mixed with other drugs without the user's knowledge. Fentanyl and other synthetic opioids were involved in more than 70% of opioid overdose deaths in 2022. Another factor that contributed to the high number of drug overdose deaths was the COVID-19 pandemic, which disrupted access to treatment and recovery services, increased social isolation and stress, and exacerbated existing health disparities. The pandemic also affected the supply and demand of illicit drugs, leading to more variability and unpredictability in their potency and composition. The impact of drug overdose deaths was not evenly distributed across the population. Some groups were more vulnerable and affected than others. For example, non-Hispanic Black or African American persons and non-Hispanic American Indian or Alaska Native persons had the highest rates of drug overdose deaths in 2022, followed by non-Hispanic white persons. Men were also more likely than women to die from drug overdoses, especially among young adults aged 25 to 34 years. Drug overdose deaths are a national tragedy that require urgent and comprehensive action. The Biden administration has taken several steps to address this crisis, such as expanding access to medication-assisted treatment, naloxone, and harm reduction services, supporting evidence-based prevention and intervention programs, enhancing data collection and surveillance, and strengthening international cooperation to disrupt the flow of illicit drugs. However, more work needs to be done to save lives and end the opioid epidemic.